Hello, this is Talking Europe, and today we're going to explore how the EU deals with outbreaks of disease. The latest scare for Europeans has been the Hantavirus, detected on a cruise ship, the MV Hondius, which subsequently docked in Spain. Experts keep emphasizing that this virus is not like COVID-19 and is much less infectious. But still, the EU's civil protection mechanism was triggered, and several member states took part in evacuation flights from Tenerife in the Canary Islands. To discuss the current virus threats to Europe and what lessons the EU has learnt from the COVID pandemic 6 years ago, I'm joined by two MEPs. Stine Bosse is a Danish MEP from the Renew Europe group, and she's vice chair of the Committee on Public Health. Welcome to you.
Thank you very much.
And I'm also here with Lera Pajín, a Spanish MEP from the Socialists and Democrats, former Minister of Health in the Spanish government and a member of the Intergroup on Resilience, Disaster Management and Civil Protection here at the EU Parliament. Welcome to you as well, Lera Pajín.
Thank you, it's a pleasure.
Let's start with Hantavirus in Spain particularly. How do you think the Spanish authorities handled this outbreak?
Well, I really think that this example is small in scale, but very big as lesson. Why? Because I think the response from Spain, but also from more than 24 countries, the civil protection mechanism was from, first of all, based on science and knowledge. Second, based on effectiveness. Third, through the coordination in a very complex response, because to coordinate different member states with different systems is not easy, but it was effective. And of course, for also trying to fight against disinformation. So the four pillars of this reaction or response for me are key for the future and as good example to how to do it.
What did you make of the response, Stine?
No, I also think that it was clear that there was a lot more knowledge around, there was a lot more coordination, and the response was clearly effective. And at least what reached many of us as citizens was a comforting way of information, but not sort of this scaring and sort of building up people's minds to be too scared. So I think it was a good learning. And I think it was also showing that things have happened since the COVID-19.
Yeah, obviously some things have changed, but some things haven't. I mean, if we look at public health systems across the EU, they're very much under pressure. A majority of EU member states since COVID have been reporting problems with shortages of skilled doctors and nurses. So did we just get lucky that this particular virus is, so far it hasn't mutated, that the Andean variant, we haven't had a major spread of infection across the EU, because we would face some of the same structural weaknesses as we did 6 years ago?
Yeah, well, I think first of all that the COVID-19 pandemic was a global wake-up call. And I think if we think about the past, we can say that we were not ready to prevent and to respond to the pandemic. I really think that now we are better prepared, but of course we need to continue strengthening our capacities. Of course, as you mentioned, the public investment on health is very important, but at the same time it's very important to see and to understand that now we have not domestic problems and global problems. That the outbreak, for example, in Congo now, it's a global problem and it's about our security also. So, of course, the public investment in our countries is essential. The strategic autonomy in terms of medicines it's vital, but at the same time we need to cooperate and to guarantee the technical and scientific cooperation with other countries from Global South.
Stine Bosse, what do you think is the main thing that we haven't learnt from COVID then? I mean, I know you've talked in the plenaries here about the importance of jointly purchasing medicines, having a strategic autonomy in supply of medicines and stockpiling as well. Has the EU achieved any of those things, or is it just you know, the agenda has moved on and we don't care anymore, sort of thing?
No, I'm actually happy to say that the Critical Medicines Act that we have just passed is actually exactly doing this. It's making sure that you can now, when it comes to public procurement, the countries can work closer together. When it comes to stockpiling, there's a model for how to stockpile more intelligent, so that you actually work together also on these issues. So I do think that there are very positive movements in that direction. But I also want to say that on a more general note, it comes to both infections and diseases that are infectious, but also in other areas, there is room for improvement. There's so much more, and talking about healthcare systems under pressure,
Exactly.
there's so many more areas where we can do a lot more together and cheaper and more efficient. So I see that during the next, say, 5, 10, 20 years, we will see a lot more of cooperation, of also aligning together, also facing the competition situation from China, from US, making sure that we're looking after the citizens of Europe.
Yeah.
And of course, also the pharmaceutical sector here in Europe is under extreme pressure. So there are many, many areas for us to worry about and to work more together.
On working more together, of course, the big challenge the EU faces is that you've got 27 national health policies, but you've also got a union of free movement of people and viruses.
Yeah.
So how do you square those two things together?
I think it's one of the lessons from the pandemic again. So now when we are discussing in this camera the Union Civil Protection Mechanism, we are trying to ensure 3 very specific items. First of all, better coordination between, first of all, different departments of the Commission, then between the Commission and Member States, and then Commission, Member States, international and multilateralism system, and Global South countries. This coordination in different levels is absolutely key. For us, it's also very important to have engaged local and regional governments in this kind of crisis, because they know very well, where are the most vulnerable population, the key elements in towns and regions, so that's very important also. But at the same time, I think that when we here are talking about security all the time in the parliament, in the discussions, well, so global health is one of the most important elements in terms of security. So we need to, to be more prepared, and not only talk about reaction or response, talk more about anticipation, prevention, and then we can do more and better in that way.
Let's take a concrete example of that. We shouldn't forget also this deadly Ebola outbreak in DRC, in Africa. Do you think Europe has anticipated that?
Yes.
Yeah.
I mean, also I think it's worth mentioning that we have this agency. It's actually placed in Stockholm, but that's just, I guess, not by coincidence, but it is. ECDC. And
European Centre for Disease Prevention and Control, just for our viewers to be clear.
People.
Thank you very much. But that's, they actually warned when the COVID-19 was approaching. Nobody wanted to listen. I'm sorry, but that was the situation. No health ministers, no prime ministers. It was all like, what is this they're talking about? That has changed. So they have been upgraded, and there's much more attention to their work. And I do think that the Ebola outbreak is also something that you would see that they are worried about and that they are monitoring very carefully, of course, together with WHO.
Exactly.
And this was anticipated because when the US took the very strange decision to completely pull out of WHO and the US aid at the same time, everybody here in the Parliament working with the healthcare issues was saying, what is this? This is going to affect us. This will have an impact. So yes, in that sense, it was talked about, at least on the abstract level, saying that, we need to upgrade ourselves in preventing that, talking about prevention, that this will affect us negatively.
Yeah, and I really think, if I mean, that we need to build a kind of culture of preparedness in our cities, in our societies, engaging all the citizens. I really think that people need to know how, how to react and how to respond when we have a global crisis.
Yeah, I think that's sort of been very patchy in the way it's actually been done in the member states. Despite the Ninisto report, and I interviewed him actually once, this whole EU preparedness. In France, for example, we don't have kits that are just given out to people to prepare for 3 days of crisis, for example. I mean, the awareness has really got to change.
Look, and I can only agree, awareness in many, many areas. And just to give you an example, this is regarding defense. But in Sweden, which is very close to Denmark, for ages they had this very, very thick, lessons to learn to be prepared. And this is for security and big incidents, including war. In Denmark, we had nothing. So that has been, of course, now upgraded. So we have to learn that unfortunately, the world we are living in now is much more exposed to big crises. That goes for infections. It goes, unfortunately, for war situations, climate situations, with floods, with storms, and all these areas. So we need our citizens to be much more alert and prepared.
Yeah.
We'll have to end it there. A lot more we could say, but I think you gave a really good sort of overview of the problem. So thank you so much to both of you, Lera Paquin and Stine Bosse. That's all for this episode of Talking Europe. Glad you could join us here on France 24.